Congratulations on making it through the liquid phase. The hardest part, I think, of this journey right after surgery. Today, we're going to talk about the pureed phase. So your diet timeline after weight loss surgery really depends on which procedure you had. If you had gastric bypass, you're on liquids for 2 weeks, and then you will advance to pureed phase, soft foods, and then on to high protein, low carb. And the reason for this is the gastric bypass has a much shorter suture line, and so we are able to advance your diet more quickly without risk of pulling those sutures apart. If you had gastric sleeve, then you will remain on the liquid phase for 4 full weeks and then progress on to the pureed phase for 2 weeks, soft food for 2 weeks, and then on to a high protein, low carb diet. And the reason for this timeline is that you have a much longer suture line. And so with adding in more food and more texture too soon, it is conceivable that the suture line can pull apart more easily when we ask your stomach to digest heavier foods. So in order to reduce your risk of developing a leak after surgery, research has shown that patients with the gastric sleeve do better if we keep food to a minimum and keep you on a liquid diet for a month, allowing that suture line more time to heal. So I always like to say that your stomach is in training after surgery. You're on a pre-op diet that's modified for the 2 weeks before surgery, and then of course we have you on a very limited liquid diet immediately following surgery for that first 2 to 4 weeks. 2 weeks of liquids for the bypass, 4 weeks of liquids for the gastric sleeve. And as you can envision, you start out with clear liquids that are very thin consistency, that are relatively easy to get down, to maintain your hydration. When you get a few days out from surgery, we start to incorporate a higher nutritional quality beverage by adding in milk. And then you progress from there to soups, which are a slightly thicker texture. And from there now, the natural progression would be on to puree foods for 2 weeks. After puree, you'll progress to basically a thicker pureed food or soft foods, and then on to a bariatric low carb, high protein diet. And I always, kind of compare, it may not be a good analogy, but compare to folks who may have had a knee replacement or a hip replacement. When those folks wake up from surgery, they don't leave the hospital running. They start out with a little assistance with walking, and then they may progress to a walker for a period of time. As they get a little bit physically stronger, they may move to a cane and then eventually be able to ambulate without the cane. And so your diet phases are very much similar to the walker and the cane after someone who's had orthopedic surgery. The diet phases are the phases that are necessary in order to make sure your stomach has time to adapt and to basically learn to digest food again. So if you think that you want to try and skip any of these phases, imagine how that would go if you were an orthopedic patient and you decided you're going to skip using the walker. So the recommendations that we give you with the diet guidelines are really so that you have hopefully any type of minimal symptoms, that it does optimize your stomach's ability to heal and to be able to digest food successfully without giving you any type of distress. One of the other big questions that I often hear right after surgery is folks who are weighing themselves every day or sometimes multiple times in the same day and starting to become discouraged or frustrated because they feel like they're not losing weight quickly enough. I cannot emphasize enough that once you have gone through surgery, your body needs about 7 to 8 weeks to heal. And healing is a repairing process where your body is building tissue. Weight loss is actually a process where we're breaking down tissue, we're breaking down body fat. And so your body can't be healing you and losing weight at the same time. And so your weight loss during your initial post-operative period up to the 90 days is really rather slow. So don't become too discouraged if you're weighing on and off the scale. I promise you that your weight loss will happen. Trust the process. If you follow the diet guidelines, if you are following the physical activity recommendations, your weight loss will happen, I promise. So what to expect? Your minimal weight loss at this point. If you're losing some weight along the way, celebrate that. That's fantastic, but just don't expect to see big drops in the numbers on the scale. Again, your body's healing, and during this window of time, your weight loss will be slow. In addition to that, your calorie intake is really low. We've had you on a very minimal diet. You're probably averaging 400 or 500 calories a day. And so as a result of that as well, your weight loss is going to be a little bit slower. As your diet progresses, so as we transition you to the pureed phase and then on to soft foods, you will see your weight loss pace start to pick up as we increase your calorie level. And once you're through that 7 to 8 week window of healing, you will also see your weight loss start to pick up pace and increase. The best window of time for your weight loss and when we expect to see the most weight loss with patients who have had gastric sleeve and gastric bypass is between 3 to 9 months after surgery. So at this stage, you have tons of time left before you even get to that window of time. Be practicing good habits, be working on establishing a routine, make sure that you have a strategy for preparing healthy foods at home, begin to work on committing to a time to perform your exercise every day. If you are developing a solid foundation, these things will all help you not only to reach your weight loss goal, but also to successfully maintain that weight loss long term. We're going to move on now and talk about what types of foods you'll eat on the Puree diet, what are your goals, and so what do you need to focus on, and then what you'll be more specifically eating during this 2-week period of time. So what exactly are the goals as you transition? You know, having a liquid diet for 4 weeks is really challenging. You should feel good and congratulate yourself for making it through that 4 weeks. That's really the most challenging time, honestly. As you progress out from surgery, it really does become easier with each phase that you navigate. The goals really aren't changing too much. You are probably averaging about 400 to maybe 500 calories a day, which is not enough. And so one of your first goals will be to work to really increase your calorie intake by adding in appropriate pureed foods. And your calorie goal will really be to get to 500 to 600 calories initially on the pureed diet, and then continue to progress, increasing your calories as your diet options and your food choices expand. So on the soft phase, you'll be able to hopefully add some more foods in and increase your caloric intake to 700 or 800 calories. And then by the time you come back for your 3-month post-op visit with the surgeon, we would really hope to see that you are somewhere between 800 to 1,000 calories. Your goal for protein really doesn't change either. So you're looking to continue to get 80 to 100 grams of protein in. On the liquid phase, you are using all protein supplements in order to meet that goal. Now that you'll be able to add in some pureed protein foods, you will be able to use a combination of food and protein shakes in order to reach 80 to 100 grams of protein every day. We would still advise that you eat your protein first at meals. So as you have small pureed meals for breakfast, lunch, and dinner, you do want to make sure and eat that pureed protein first. And then if you're supplementing that with any type of pureed fruits or vegetables, you would eat those second because they're lower in protein. In addition to that, one of your goals is to continue to drink 80 to 100 ounces of fluids every day. Half of that we recommend to be coming from water, and then the other half you can use any type of beverage that's sugar-free and not carbonated. This is also the phase where you will no longer, you'll have to start your window of not eating and drinking together. And so what we mean by that is that 30 minutes prior to your scheduled mealtime, you will need to stop drinking. That allows your stomach to clear enough space in order to accommodate food. And then once you've eaten your meal, we would request that you wait an additional 30 to 60 minutes after eating before you return to drinking. This can really be challenging because you will get full quickly. It also cuts into your window of time where you're able to drink and get all of your fluids in. There are kind of good timelines in your book and your handouts that we provide you. Setting up reminders using the Berrytastic app or using an Outlook calendar is really something we highly recommend. Having those reminders really will help to prompt you during your busy day to make sure that you don't miss your window to stop drinking or to start back drinking. It's easy to get off track when you're busy and you're not necessarily paying attention to that timeline or that schedule or the clock on the wall. And so having some prompts and things to make sure that it keeps you focused and keeps you on schedule is really important. It will take some practice in order to decide and determine what strategy works best for you in terms of timing of meals and fluids. And just remember that even though we want you to get 80 to 100 ounces of fluid in every day, your risk of dehydration is quite low. And so just like prior to surgery, you may have days where you drink really well and you hit that goal, and you may have days that are really busy and you aren't quite able to reach that goal. And it just needs to be something that you put more emphasis and focus on so that you are able to, able to stay as close to or within that range as we recommend. So establishing a really good schedule is critical, and I cannot emphasize enough the importance of actually sitting down and writing out what your meal times, what your target times are for eating and drinking. You're probably either back to work or getting ready to transition back to work, so that will layer on a much more hectic schedule, and that can really compete sometimes with your nutritional goals after weight loss surgery. So there are some good examples in your bariatric book, and just to walk you through an example here, think about what time you get up in the morning. You really should start out with fluids ideally. So if you wake up early, in this example, 6 to 6:30, work to get in, I would say 6 to 8 ounces of fluids. We do encourage you to not drink too quickly and not to overfill your pouch, again, so that you're not putting stress on that suture line. But you have probably already noticed that you can sip more than 6 ounces in an hour quite easily. So I would not exceed more than probably 8 to 10 ounces in an hour, but if you are sipping constantly and not gulping or chugging your fluids, but just taking small sips over the course of 45 minutes to an hour, it is not inconceivable that you could probably drink 8 to 12 ounces. As long as you're taking small sips and doing that safely and not feeling any discomfort, fullness, pain, or pressure, then you will be able to drink more fluids within an hour's time span. And of course, if you're drinking, then you have to wait your 30 minutes, stop drinking from 6:30 to 7 in the morning, allow your stomach time to clear, create a little bit of space, and that allows you room then to go ahead and eat breakfast. We do like you to eat your first meal of the day within 2 hours of waking, and ideally, you may drink a protein shake in the morning, and that counts as your fluid goal, and it also counts towards your protein goal, and it may be a quick, convenient, and easy option, and that's fine if you want to do that on the pureed phase. If you decide that you're actually going to eat solid food, then you'll need to wait the 30 minutes prior to your meal, and then go on ahead at breakfast time and eat your pureed protein. So for example, if you were to eat an egg, up to 2 eggs pureed for breakfast, each egg is about an ounce of protein, so that's 6 to 7 grams of protein per egg. That would give you 6 to 7 up to 14 grams of protein for breakfast. You'll then wait a half an hour after eating before you start drinking back. If you feel very full after 30 minutes of resting and not drinking after your meal, then you may need to wait longer until your stomach has time to clear that food. So how quickly you start drinking back after a meal, at minimum, it should be 30 minutes. But if you still feel pressure and fullness after eating, then you may need to wait 60 minutes, or you may even need to wait a little bit longer than that until your stomach has time to clear. So listen to your body, use good posture, take your time, really step away from your commitments during meal times, and make sure you're focusing on developing good habits. So between 8:30 and 10 o'clock, as another example, you may start sipping throughout the course of that hour to hour and a half, with a goal of getting in another 12 to 16 ounces of fluid. Prior to your snack, 30 minutes before, you're going to stop drinking and then eat your mid-morning snack at 10:30 to 11. Again, aiming for an ounce to 2 ounces of protein is a good goal, so another 7 to 14 grams of protein. And then wait 30 minutes before you start back drinking. So really think about what your workday looks like, what your meal times are in your typical day, and come up with a strategy. I know we've touched on this before, so I will not, I will not go over this entire slide again. I do want to say, though, that setting reminders in your phone using the Berrytastic app or some sort of calendar, your Outlook calendar, can be an excellent tool to help develop that pattern and that routine. You do need to eat even if you're not hungry. The goal right after weight loss surgery, of course, is to give you a sense of fullness. And so if you're not hungry, you've got to eat regardless throughout your day in order to get in your fluids and protein. So set a reminder, set a clock, and you do need to establish good habits and eat. And as we talked about, the weight loss during this 2-week period time frame is very small. So don't focus on weight loss, focus on healthy habits. Few helpful hints. It may sound funny, but you will notice that small details may make a big difference in how you feel and how you tolerate food after surgery. One of the best hints that I can give you is having proper posture. And so if you are trying to drink thicker liquids, or if you're trying to advance to pureed food and you're eating reclined in the recliner, or you're sitting in a chair and you're hunched over, you may find that the liquids and fluids really get kind of hung up and don't travel down to your stomach very, very easily. You may feel pressure in your chest, or you may find that it just it's not able to go down. So if you were given a pillow in the hospital that they provided for you to brace with for your suture line, then I always recommend taking that pillow and using it as lumbar support. So put it behind you in the chair, and that helps to prop your posture give you more support, helps you to sit up nice and tall. When you sit up nice and tall, it helps to expand your shoulders, opens up your chest area so that you tend to be able to sit and chew and swallow, and things go down much more easily. I do also recommend using an infant or a toddler spoon. Your portion sizes now are probably going to start out between 2 and 3 tablespoonfuls, and you don't want to just swallow down or wolf down, 3 spoonfuls and call it a day or call it breakfast. You want to then take those small portion sizes and divide that up into smaller bites for your meal. So if you have an infant or a toddler spoon at home, that helps you to take smaller bites, allows you to slow down your pace of eating as well. Folks often are very hurried and very busy. We don't take time to savor our food, to enjoy our food, and you will find that if you do eat too big a bite or you do eat too quickly, that you may have some nausea, discomfort, or in some instances you could actually vomit the food back up. It should take you 30 minutes to eat a meal. And what I mean by a meal is, again, that 3 to 5 tablespoon portion size. So again, if you envision 3 to 5 tablespoons, that's quite a small portion. You're going to get full quickly on a very small serving. But your goal is to take your time and try and get that portion size to last at least 20 minutes, if not 30. So really take your time, especially when you're starting out eating puree. And then make sure to chew your food really well. So we would recommend 30 times prior to swallowing. And on the puree, you may not have to chew as often or as much, but as you progress further out from surgery onto soft foods and regular textured foods, it will be important to continue to practice chewing your food really well. So the better you chew your food, the more you assist your stomach with digesting and breaking down that food, the easier it is for your body to kind of digest and get out of it the nutrients and the nutrition that it needs. So how to puree a food. This is probably something that you have not done before. And of course, when I reference pureeing food, I'm going to really reference pureeing any type of protein food. So if you have a hand blender, if you have a regular kitchen countertop blender, if you have a food processor, if you have a baby food blender, you can use any of those items to puree your food after surgery. Now this is actually putting the food into the blender and blenderizing it, not mashing with your fork and calling that puree. You want to put your chicken or your tuna or your eggs into your food processor or blender, and then you need to add some sort of liquid to that in order to make it a smooth texture. And so if you were going to puree eggs, we would recommend some light mayonnaise, maybe some relish or relish juice to make like an egg salad, or you might use eggs and salsa and puree the two of those together. But you're going to need some type of moisture, broth, fat-free gravy, low sugar tomato sauce, some leftover cream soup that you may have had from the full liquid phase, light mayonnaise, sour cream, and you're going to puree those foods together until they're smooth. And once pureed, if you want to, you can even freeze those portions into the old ice cube trays. Each ice cube size portion is the appropriate portion size for a meal for you after surgery. And so that's a great way if you want to make pureed food ahead of time to store it in your freezer. Then you can pull it out as you need to. So before I jump ahead to portion sizes, I do also want to mention that when you're starting out on the puree diet, you really want your pureed food to be very moist, almost like a thick soup. And then as you progress through your 2 weeks on the pureed phase, you can start to thicken it up as you get into the second week. or closer to transitioning to the soft food phase. So just think that you want it to be more of a very moist, thick soup texture in the first week, and then you can thicken it up in the second week. If your food is too thick, if it's too dry, you are going to have a hard time, number one, swallowing and getting it down most likely, and number two, your stomach just does not have as much stomach acid right after surgery, and so if your food is not moist enough, it can be also challenging and more difficult to digest. So the first couple of days with your pureed portions, you want to start very slowly. In other words, don't dive in the first day and start to eat 3 meals and 3 snacks of pureed food. Your stomach hasn't had any food in its system in a month or 2 to 4 weeks. And so, it needs some time to get what we call the motility, or the digestive process, working again. It's sleeping, it's very quiet. So the first 3 days, you really want to start with a 1 ounce serving of protein, and that would be roughly 1 to 2 tablespoons of pureed food. And I would start out with 1 meal a day for the first 2 to 3 days. So you may start with pureed breakfast and eat that for 2 to 3 days, and then drink your shake for the rest of the day. If that goes well and you don't have any symptoms of any kind, then bump it up to 2 pureed meals for the next 3 days. So maybe do pureed breakfast and dinner, and then drink your shake throughout the day in order to meet your protein goal. And if that goes well, then bump it up to 3 meals a day. So really kind of stagger it, 1 meal a day for a few days. If that goes well, bump it up to 2 meals for a few days. And if that goes well, bump it up to 3 meals. And again, focusing on protein first. So we're recommending, again, starting out with 1 to 2 tablespoons. If that works well for you and you don't have any pain, you don't have any discomfort, you don't have any pressure with eating, you can increase your portion sizes slightly, but you should fall between 3 to 5 tablespoons at the most per meal. And regardless of that, when you feel pain, pressure, fullness, that's your cue to stop eating, regardless of how much you've had to eat. So if you have 1 tablespoon of food and you feel pressure, pain, fullness, that's your cue to stop. As I mentioned, after a couple of days, if you feel like you are tolerating the 1 meal a day well, and you're tolerating the pureed food consistency well, you can increase your portions if you feel safe and able to do that. On my slide, it does show that you can puree fruit and vegetable along with your protein, but you want the majority of what you're eating and your focus to be protein, because you will get full quickly and you don't want to fill up on low protein fruits or low protein vegetables. If you have room, you can supplement those in, but again, protein should be your focus. So just continuing with some guidance on portions, your portion is based on when you get full. So whether or not you've eaten the typical 3 to 5 tablespoons at a meal doesn't matter. If you eat 1 tablespoon and you're full, you're going to stop eating. If you eat 3 tablespoons and you start to think you're getting full, that's your cue to stop. But when you have that thought of, gosh, I think I'm getting full, that's your cue to stop eating. You will notice that foods that are more dense will give you a feeling of fullness more quickly. So you may be able to eat 3 or 4 ounces of yogurt. It's soft and squishy, and I always say it kind of slides on through your digestive tract pretty easily. Whereas if you puree something more dense like chicken or beef or pork, it's heavier, it feels heavier in your hand. When you puree it, it still sits heavy in your stomach. You will get much more full more quickly on a very small serving of meat than you will on something like ricotta cheese or yogurt or applesauce. So just pay attention to how you feel. And again, when you start to have that feeling of fullness or that thought of, gosh, I think I'm getting full, that's your cue to stop. If you're developing the hiccups or you find that you get a runny nose after you've eaten, almost like you're having allergies, then those are both symptoms that you're eating too much. So cut back on your portion size. So what kind of things can you add to your pureed diet? This can be very intimidating for folks, and I always recommend keeping it simple. Puree foods or add in foods to start with that don't either need to be modified or don't look that drastically different than the normal everyday version. So in other words, start out with a little bit of applesauce if you want to, just to see how it feels and see how it goes. Although applesauce is low in protein, it would be a very easy food to digest and get started with. If you eat dairy, then obviously switching to yogurt and trying some yogurt for a couple of days would be an easy food to accommodate. You can do the 100-calorie yogurt in regular form or the 100-calorie Greek yogurt. Certainly the Greek yogurt has more protein, so that's going to help you reach your goal faster. If you eat cottage cheese or you're willing to try some cottage cheese, you can puree cottage cheese and fruit together, so canned peaches or pears, and you can put that with your blenderized pureed cottage cheese. You'll probably eat 2-3 tablespoons for a meal or a sitting. There's a very popular recipe in our cookbook called ricotta bake, which is basically like lasagna filling, and you can make the ricotta filling, add tomato sauce. You can even puree that with some ground meat if you want to. You can cook it in the microwave. You can bake it in the oven. A very popular meal that folks will continue to eat oftentimes long after the pureed stage. You can make a pot of chili with lean ground beef or lean ground chicken or turkey. And I would leave out the dried beans and just focus on making it with your lean meat and tomato sauce, and then run that through your food processor or your blender. So all of these are really easy, quick meal ideas. We mentioned egg salad, tuna salad, chicken salad, made at home, light mayo. Add some extra relish juice if you want to. You can season it with salt and pepper. You can add in, a little bit of onion if you want to, and then run that through your blender or your food processor. Most patients will pick about 3 to 4 foods, and that is pretty much what they will rely on and eat for the 2-week puree diet. And then they will supplement still with protein shakes. So don't feel like you have to be adding in a lot of different foods or a lot of variety at this point. As you move through the diet phases and you get further out from surgery, you will start to incorporate more variety, and you'll also then be able to incorporate more fruits and vegetables. But predominantly, again, you should be eating mostly pureed protein at this point. Just to give you some more sample meal ideas that folks will often use during the pureed stage, we talked about egg salad, tuna salad, chicken salad, made at home, fat-free or light mayo, relish, onion. You can puree chicken with some of your cream of chicken soup, and actually that's quite tasty. It's kind of like chicken and rice casserole that you might make with canned, with chicken and canned cream soup and the rice. You're just leaving out the rice, the starchy part of it. So, or you can do you can do pureed chicken with fat-free gravy, and you can get the commercial store gravy. Just check the label and make sure that it's low fat or fat-free. You can, again, do chicken and turkey chili. You can make your own taco meat. So again, lean meat, taco seasoning packet, some salsa, cook it down, run that through your food processor or your blender. You can then top that with some low-fat sour cream or a little bit of guacamole. So your family could be eating tacos and you're just eating a modified version of the protein filling. You can take chicken or turkey and again puree it with fat-free gravy, and also make the cauliflower mashed potatoes and combine the two of those and have chicken and potatoes or mock potatoes. Eggs and salsa, which we talked about. So lots of good recipes online as well as in our cookbook. And so, feel free to explore other options, but don't make it harder than it is. In terms of trying to make elaborate meals, you don't need to do that. It's just starting to introduce and incorporate some pureed food into your day is the important part. Naturally, when you think of pureed diets and pureed foods, your brain leads you to those starchy carbs that we want you to avoid. So it's not uncommon for folks to think, oh, I can have grits or oatmeal or mashed potatoes. But those are the high carb, high starch foods that we want you to avoid at this point. And we really discourage you from eating those foods because they tend to, we say bolus or ball up when you eat them. They tend to swell once you've eaten them. They give you patients a lot of pain and discomfort after surgery. They can make you feel too full. Sometimes they don't digest very easily, and they're low in protein, so they really don't support your nutritional goals. So any type of cereals, grits, oatmeal, mashed potatoes, anything like that are pretty much off limits. You want to think protein, protein, protein. So before we move on to the soft diet phase, I wanted to take a minute just to talk about what symptoms you may have if you're not tolerating the puree diet well. The most common symptoms that patients experience would be nausea and sometimes vomiting, and it could be a combination of both. And there's really some common reasons why folks may experience more nausea or vomiting. Some folks may not experience any at all. But if you do, go back and ask yourself these couple of questions. Are you eating too much? So if you're overeating in portion sizes, that certainly can give you nausea, or your stomach size being so small, you may actually vomit the food back because it has nowhere to go. So definitely make sure you're measuring your portions and that you're paying attention to your hunger and fullness cues. If you're eating too fast, that's another common reason that can give you nausea or vomiting. We definitely advise that you take your time, you're using small utensils, you're dedicating time for your meals, you're taking 20 to 30 minutes time chewing your food well, and all of those are strategies to slow down your pace of eating. If you're eating too fast or you're drinking too fast, that can give you symptoms of nausea and sometimes vomiting. And of course, if your food is too dry or too thick, so after surgery, and if you're taking any type of antacid as far as Pepcid or prescription antacid medications, that basically is removing a lot of the stomach acid that is designed to digest and break down your food. So if your food is too dry, then you certainly may experience difficulty with digesting different types of foods, particularly protein foods. You may have more nausea or vomiting. Or if your food is too thick, and I always use refried beans as an example. If you've ever opened a can of refried beans, you know that looking at the can, once it's open, you can see that the beans are very smooth in texture. But if you turn the can upside down, you will not get those beans out of that can until you use a spoon and scoop them out. Anything that is pureed and is that thick is going to be too thick in texture, sit heavy, and be very difficult to digest. So again, you want to make sure that whatever food you're pureeing, it's nice and moist, that it has plenty of chicken broth or barbecue sauce or low-fat gravy or light mayonnaise, anything that's going to add moisture. And so that not only are you adding moisture, but you're thinning out the texture or the consistency. If it's too thick, it will certainly give you nausea and possibly vomiting. Certainly, if you're having any degree of intolerance once you advance your diet to Puree, we would encourage you to contact our office, and you can call the main number at 910-295-0884 to reach any of us if you have any questions or concerns. We certainly do not want you having nausea or vomiting after surgery. It is not typical, and it should not be common. So if you have these symptoms, again, we would encourage you to reach out as soon as you can so we can help you to come up with some strategies and some solutions. Okay, we're now going to move on to the second 2 weeks after the Puree diet. So between visits, you will have a month's window where you are on the Puree diet for 2 weeks, and then you progress to the soft diet on your own between appointments. Again, if you have questions or concerns, certainly reach out to us at any point in time, but you will remain on the soft food diet for about starting in about week 6, week 7 after surgery. Certainly that timeline varies a little bit depending on how you feel and how you've done. If the surgeon has advised you differently at one of your appointments, certainly keep in line with the recommendations the surgeon gave you in the office. And if you're not sure, again, feel free to reach out and contact the office. 910-295-0884 so we can clarify for you. So what does the soft diet look like? Your daily goals are somewhat similar as they have been throughout this journey. But at this point, your calorie range should be creeping upwards. So hopefully you are close to, if not at 800 to 1,000 calories a day. If you're not quite at that goal, then continue to work to incorporate meals and snacks to reach that goal. And if you need help, we are here to help you. Your protein goal has not changed. It remains at 80 to 100 grams of protein, but gradually you should be increasing the protein that you are eating from solid food and beginning to really cut back and rely less on those protein supplements and protein drinks. And typically by the time that you are at 3 months post-surgery, we would like to see you down to either 1 protein shake a day or even no protein shakes a day if you're fortunate enough to be meeting your goal from food. You still want to work to eat your protein first and then gradually incorporate a fruit or vegetable or a low-fat dairy product if you have room, and you're continuing to avoid any of the sources of carbohydrate from anything starchy. Your fluid goal remains the same at 80 to 100 ounces, but you're now drinking between meals, waiting for 30 minutes before your meal and 30 to 60 minutes after your meal before you resume drinking, allowing your food time to digest. So no eating and drinking together. You should be working back to preparing more foods at home, again transitioning off of the reliance of protein shakes and back onto whole foods. Bake, broil, grill, poach, use a crock pot, use a pressure cooker, any of those forms of cooking that really help to keep your food moist. Choose any meats that can be cut with a fork and not rely on a knife to cut. So when you're on the soft food phase, you want to really think about foods that do not need a knife. Those foods often are a symptom of a meat or vegetable that can be more tough. If it's tough to cut, then it's probably more difficult to digest. So you can choose any form of protein on the soft food diet as long as you don't need a knife to cut it. So no dense grilled pork chops, no big cuts of steak or beef. You want to stick to steamed shrimp, bake or broiled fish, chicken, turkey, pork that's cooked in your pressure cooker, your crock pot that kind of falls apart with cooking a hard-boiled or scrambled egg. So again, things that are very soft and tender. Trim off any visible fat before cooking and make sure you're removing the skin off your chicken and turkey. That's where most of the fat and calories reside. And of course, nothing deep fried. Anything too high in fat and too greasy will likely give you nausea and may actually give you dumping syndrome. And be sure to keep adding low-fat sauces and marinades to help keep your protein sources moist. There are certain foods that you'll need to avoid that are notoriously harder to digest, and those would be any raw fibrous fruits and vegetables. So at this stage, you really want to be focusing on soft cooked meats, soft cooked vegetables, or fruit that doesn't have any type of skins. So, portion of a banana, a ripe piece of honeydew or cantaloupe melon would be okay. A small piece of watermelon would be easy to digest, but anything like an apple, a pear, a plum, berries that have heavy skins or seeds, we would continue to advise you to avoid at this point. Spicy foods is really very individualized. Some folks do very well with spicy foods early on. You can continue to eat spicy foods if that's what you enjoy, as long as it's not giving you any type of symptoms of heartburn or reflux. Any tough, stringy, or dry meats, as we've mentioned previously, are very difficult to digest, and you'll want to limit and avoid those as much as possible. Be very careful of processed meats, hot dogs, bacon, sausage, heavily processed luncheon meats. The quality of protein in those foods is not very good. The fat content typically is very high, and a lot of those foods contain nitrites and nitrates, which are obesity promoting foods. Any type of dried beans, of course, are higher in fiber and can be very gassy, so we would recommend that you avoid those, along with the fact that they're starchy and you're trying to avoid any sources of those starches at this point in time. Nuts and seeds, just being that they are high fat and high fiber. Again, something that you will be able to eat down the road, but for now we're going to hold off from introducing any kind of nuts and seeds. And then again, anything starchy, bread, cereals, crackers, snack foods, rice, potatoes, pastas. We will hold you off on eating those for up to 6 months until you reach your weight goal or your 6-month mark, and have you talk with the surgeon to assess where you are at your 6-month follow-up visit to determine if and when we'll introduce those foods back. This slide just really focuses in on meats and protein sources. What are good choices? What are choices that you can introduce in small quantities, and which protein sources you really want to avoid? So in terms of meats and proteins, the choices that are the best for you are going to be any that have 3 grams of fat per serving or less, or per ounce or less. So if you're looking at any type of meat that comes with a nutrition facts label, certainly you can look at the total fat grams and compare. Any form of boneless, skinless chicken or turkey is going to be lean pork loin, fish, salmon, any types of different seafood, as long as it's not breaded and fried, so shrimp, crab, eggs, lean lunch meat, preferably boar's head lunch meats that are high quality. If you like breakfast meats, Canadian bacon, venison, elk are all great choices. Meats with less than 5 grams of fat per ounce, turkey bacon, turkey sausage you can use on occasion, but again, they are fairly high in fat, so we would encourage you to limit your use of these. And then any meats with more than 5 grams of fat per ounce, so anything fried, regular bacon, regular sausage, hot dogs, salami, bologna. Your calorie level is so small after surgery, particularly in the first 3 to 6 months. These are what we would call big ticket items that add up quickly. They're not as good a source of quality protein, and so we would recommend that you avoid these as much as possible. Just as a quick reminder, I wanted to review counting your protein. It's important to be sure to track your protein from food every day, and that way you will know if you need to drink or supplement with a protein drink in order to meet your protein goal every day. So remember, if you have a 1 ounce portion, a 1 ounce portion of protein has set about 7 grams of protein per ounce. in a 1-ounce serving is about the size of an egg. So if you can use this as a general rule, then you can estimate your portion sizes. So if you had a 2-ounce serving, 2 ounces times 7 would be 14 grams of protein. 3 ounces would be 3 times 7 would be 21 grams of protein. So as you track throughout the day, if you find that you're at 50 grams of protein for the day, you may need to drink the remainder in the form of a protein shake to get to your goal. If you're able to get 60 or 70 grams of protein in your day, then you may only need to drink a portion of a shake in order to get to your goal. Ideally, over time, you want to be increasing the protein you're eating from solid food and then gradually cutting back to 1 or no protein shakes. Similarly to when you were on the diet guidelines prior to surgery, we talked a lot about what we call protein and produce. Produce meaning fruits and vegetables. On the soft food phase, we recommend cooked vegetables only, and the vegetables that are not starchy. So green beans, asparagus, carrots, spinach, cooked greens, mushrooms, onions, peppers, tomatoes, yellow squash, zucchini. Prepared how you like it, as long as it's not bread and fried. So you can steam it, you can use steamer bags, you can put it on the grill, you can roast these in the oven. You want to limit the gassy vegetables, broccoli, cauliflower, Brussels sprouts, cabbage. Those foods don't mean that they're off limits, but they may give you a little more stomach distress just because they are gassier in nature, higher in fiber. So if you choose and like these particular foods, just start out with a very small serving. You can use over-the-counter Gas-X or Beano if you do have symptoms to help manage that. But start with small servings so that you don't end up with a lot of side effects. And of course, the vegetables that you want to avoid are any of those starchy raw vegetables, corn, peas, potatoes, all the dried beans and lentils, possibly celery because it's very stringy. So if you eventually want to introduce celery, we would say dice it fine, make sure you're chewing really well. So here's a couple pictures of some easy meal ideas. Salmon baked in the oven, boiled or steamed shrimp, hard-boiled egg. This picture shows a can of tuna, but honestly the small 2-ounce pouches or packs of tuna work really well. You could roast a chicken, make sure and take off the skin, and then pair whatever protein that you've chosen with about 1/4 cup of some type of cooked vegetable. It could be cooked carrots, steamed green beans, or the steamer bag of green beans, roasted cauliflower, Brussels sprouts, grilled zucchini, whatever your preference is. As far as fruit servings, some of the better choices when you're early in your weight loss phase and trying to seek out soft fruits, a portion of a banana, an apple. You could eat the pulpy portion of the apple. You would just want to peel off the skin of an apple or a pear, a plum, anything that's got that heavy skin on it. Canned fruit packed in its own juice, different types of melon. You could eat nectarine, orange, small clementine. Those tend to be really good choices. Frozen fruit, you can oftentimes add these to your protein shakes after surgery once you're on the soft food stage. So blueberries, raspberries, strawberries, blackberries in the frozen form tend to be fine. We do want you to avoid those fresh berries. They tend to have a heavier skin and heavier seeds. And so that can be a little bit more difficult to digest potentially. And so fresh blueberries, raspberries, strawberries, we would want you to avoid on the soft food stage. So you can have the frozen form, just avoid the fresh, the fresh berries. Pineapple, very acidic, grapes with a heavy skin on them. Those are foods that you will be able to incorporate in several weeks, but on the soft food phase, we want you to avoid those. If you eat dairy, low-fat dairy can be an excellent option, not only to help get in some calcium in your diet, but also to provide protein. Some great choices of low-fat dairy would be 100-calorie yogurt, and that could be regular or Greek yogurt, fat-free or low-fat cottage cheese or ricotta cheese, skim or 1% milk, or the Fairlife milk, which is higher in protein, Lactaid if you're lactose intolerant, or you may prefer to use a low sugar soy, almond, or cashew milk. In addition to that, string cheese can be an excellent option. You do want to watch your Laughing Cow cheese, the low-fat sour cream and cream cheese. Those foods can be appropriate choices. You just have to monitor your portion size. They do contain some fat, and those fat calories can add up quickly. And you want to make sure that you're avoiding any full-fat cheeses of any kind. Full-fat cottage cheese, ricotta, sour cream, cream cheese, again, super high in calories. Your calorie limit is so low that they can really add up quickly and may stall your weight loss if you're not measuring or really tracking these foods and trying to stay in the low-fat light version. As far as fat choices go, we really like you to try and incorporate more of the heart-healthy fats, which would be the liquid oils like olive oil, canola oil, using light-based salad dressings, again, fat-free or light cream cheese, or even tub margarines, peanut butter, nut butters like almond butter, avocados, regular butter, again, can be a healthy option and can be included in your diet as long as you're measuring and tracking portion sizes. And we do want you to avoid the highly saturated fat options like coconut oil, regular full-fat salad dressing, nuts of any kind at this point, just because they may give you difficulty in digesting, and then again, regular cream cheese. So here's an example of a sample menu and timeline. You do want to sit down and try and figure out your plan and your strategy based on your work day. If you work days and you have a set meal schedule at work or set lunch break, you want to plan out your strategy in your day for eating and drinking ahead of time. If that same holds true if you work rotating shift or you work night shift, it's important to start to practice and set up target times to eat and drink so that you can develop a good routine, and that becomes habit in the future. So in this instance, at 7 a.m., eating your first meal of the day, eating 1 to 2 hard-boiled eggs to get some protein in, and pairing that with a small serving of fruit. If you get full quickly, you may be able to only eat the eggs and not eat the fruits and vegetables, and that's fine. As you get further out from surgery, you will be able to tolerate slightly larger portions, and you can begin incorporating more fruits and vegetables at that point in time. As a reminder, you're going to wait 30 minutes after eating before you start back drinking, and then shift to water or what other non-carbonated sugar-free beverages, and that's with the goal of staying hydrated. At 9 o'clock, you may build in a snack, and so you may eat 4 to 6 ounces of Greek yogurt. Could be more or less than that. When you feel full, you're going to stop eating. That just allows you to get some additional protein in the morning. Again, shifting back to drinking fluids in between meals. Stop your drinking prior to lunch, and then you may have several ounces of lean protein in a vegetable like boneless, skinless chicken baked with some green beans for lunch. So these are just a couple of quick, easy examples, foods you can pack and carry with you to work, things you can prep in advance, oftentimes staples in the diet of bariatric patients after surgery. Here's a few more examples of some list of protein foods, fruits, and vegetables. And on the right-hand side of the screen is just an example of a small plate. In this case, or in this instance, it shows you where you're going to eat predominantly protein at your meal. And then again, you may want to set aside a small serving of fruit or vegetable. But again, if you feel full quickly on the protein, you may not have room for that fruit or vegetable. And at this point in time, that's okay. So as far as protein foods, common foods that bariatrics patients tolerate well and tend to eat, again, yogurt, cottage cheese, ricotta, chicken or turkey, keeping your chicken or turkey moist. So cooking in the crock pot, the pressure cooker, rotisserie chicken, take off the skin. Any type of fish tends to be well tolerated: tuna, tilapia, cod, salmon. Soft seafood, obviously not breaded, not fried. Eggs and egg beaters, egg whites, Sometimes folks have trouble with the egg yolk because it is dry, so you may need to add some kind of moisture by making it into egg salad or making healthy deviled eggs, string cheese, and then rolling up low-fat lunch meats. As far as vegetables go, we really advise that you seek out only the cooked vegetables, just a snippet of many of the vegetables that are out there. So green beans, zucchini, yellow squash, broccoli, cauliflower, spinach, any type of cooked greens. But there's many other vegetable options that you can choose from as long as they're not starchy. And then fruits, of course, all soft fruit without skins or seeds. You can use the canned fruit packed in its own juice. You can use frozen fruit as long as it's the whole fruit frozen without added sugar. Or you can choose soft, fresh fruits like a portion of a banana, cantaloupe, watermelon, honeydew, things without skin and seeds. Couple more quick meal options. You might choose to have a hard-boiled egg in the morning with a little bit of Greek yogurt. You may decide to have an ounce or two of baked salmon. You may need to add some sort of healthy sauce to your salmon and then pair that with a small serving of green beans, 3 to 4 steamed shrimp with cocktail sauce, and again add that with a small serving of a vegetable like broccoli, or even making small slider-sized turkey burgers, 1 to 2 ounces, with some cooked carrots. So a couple more meal ideas for you. There's lots of great recipes out there. If you're in search of recipe sites and you need help with that, certainly reach out and we can provide you with lots of good sites so that you can explore additional options. If you have any questions after viewing this class on the Puree and the Soft Diet, please feel free to reach out to the program or to the dietitian, and you can reach us at 910-295-0884. In closing, I want to take a minute just to remind folks of the importance of taking your vitamin supplements. It's critical that you take your vitamins as prescribed. There is a different regimen for gastric bypass versus gastric sleeve, but both patients groups are at risk of developing serious deficiencies after weight loss surgery that can have permanent side effects. And we also advise that you take bariatric approved vitamins only. If you're not able to take the bariatric vitamins, then we advise you talk with a dietitian to make sure that we accommodate and supplement additionally what's missing in those over-the-counter vitamins. And if you cannot tolerate your vitamins, then it is critical that you call the office immediately so that we can meet with you and make sure that we are meeting your nutritional needs and that we identify some alternative solutions. Again, cannot emphasize enough the importance of taking your vitamins and taking them long term. If you have questions about this, again, certainly feel free to reach out to the program at our office, 910-295-0884.